Freud was wrong. He labeled people with mental problems without examining them. He had a watch, he had a stethoscope, and he was a neurologist. He didn't use those tools. When I started psychiatry, most psychiatrists never touched their patients. And I realized it was sort of like taking a shower dressed in a raincoat.
For the first time in literally 20 years in my struggling with this, made a huge difference.
When I walked out of his office that day, I felt like a different person, like it happened that day.
I felt as though the fog lifted.
What he has is so far above normal medicine.
I mean, he was actually taking a look at my brain and seeing what I needed. He gave me my life back.
I practiced general medicine for 5 years before I decided to go into psychiatry. If someone had told me while I was in medical school that I would go into psychiatry, I would have said that they need to have their head examined. This young man was in his late 20s with a master's degree in mathematics, wife, and a child. So he was a married man, had been treated for 2 years at UCLA as a paranoid schizophrenic. I inherited him in the second year of the residency. It made no sense to me that a paranoid schizophrenic would be able to marry, have a child. That's not typical of people with schizophrenia. So being accustomed to examining people as a general medical doctor, I started a complete systems review, and part of that is, do you have any unusual sensations on one side of your body or the other? And when I asked that question, he said yes, and I said, tell me about it. And as it turns out, prior to these episodes of rage, he had unilateral sensations that were consistent. So I ordered an EEG, and within a week, the EEG was returned with the report that he had temporal lobe epilepsy. So I removed the antipsychotic medications to which he had had really adverse reactions and prescribed an anti-seizure medication. He did so well that he was promoted. His wife was thrilled. And for 10 years, he sent me a note on the anniversary of regaining his sanity. I knew then that in order to treat my patients successfully, I had to find a way to identify the physiology in mental and emotional disorders. In 1986, under the direction of a board-certified electroencephalographer, I began incorporating visual and quantitative EEGs into my psychiatric practice. This tool has helped me to refine patient diagnoses and radically altered the dosages and compounds, both allopathic and naturopathic, that I prescribe. I call it the Brain1st approach, and it's led to life-saving changes in my patients' lives.
Brain1st is a completely different way than the conventional way that we're treating in psychiatry. And it's a much more precise way to figure out, to help someone who comes in with maybe similar symptoms as the next person.
Unlike many doctors will just give you a pill and say, try this and see if it works. He gave me an EEG. He prescribed me a specific medication, and it immediately was effective. I felt as though the fog lifted, and I could focus, and I was clear-headed and able to concentrate in a way that I had not been. I'd been struggling.
The first step is a physical examination and a comprehensive physical examination and what's called a mental status examination that includes a substantial cognitive screen. I measure and monitor each patient's vital signs, which include respiratory rate, pulse rate, blood pressure, bowel transit time, and I also monitor each patient's cognitive functions, such as immediate recall of a simple paragraph or recall of 7 numbers forward and 6 numbers in reverse, and the ability to reverse digits and letters in a sequence. Then I obtain a baseline visual EEG and quantitative EEG to determine each patient's unique brainwave signature. If we look at the human brain as an orchestra, the hypothalamus is the orchestra conductor, relaying and receiving the brain's activity. The EEG samples that electrical activity in real time and displays it in the form of 4 different types of brainwave frequencies: alpha, beta, delta, and theta. The delta frequencies are associated with sleep. The theta frequencies are associated with drowsiness. The alpha frequencies are associated with alertness, and the beta frequencies are associated with meditation and relaxation. I compare each patient's brainwave signature with that of an age-average asymptomatic person to see where there might be discrepancies. If I can detect or find a cognitive inefficiency of any sort, visual processing, auditory processing, that helps me locate an area in the brain orchestra to which I will need to attend.
When I was 15, I struggled with anorexia, and unbeknownst to my mom, but she took me to a psychiatrist because she knew something was really wrong. I was down to about 90 pounds. And the psychiatrist that I saw actually said that I was fine. And when I got in the car, I told my mom that my chest hurt and my heart hurt, and I was surprised that if I was fine, that I would actually be in pain. She took me straight to the hospital, and Dr. Emory was actually there when I was doing like the initial, almost like a consultation, and found out my pulse was 36. And so he told my mom that if she tried to actually take me out of the hospital at that point, he would step in and take legal guardianship. I was in the hospital, and he did a QEEG, and the medication that was supposed to help me, according to the QEEG, they would not allow because the primary side effect was anorexia. And Dr. Emory told me, if it's the right medication for you, there will not be any side effects. But because the side effect was anorexia, they wouldn't allow him to give it to me. I spent the next 4 years in and out of the hospital before they finally allowed me to have the medication, at which point I never went back in the hospital, and I gained about 20 pounds. He gave me my life back. I've been able to have children, live a normal, happy, healthy life.
Most patients who come to me having been treated by someone who does conventional psychiatry, most of those patients have reduced voltages in their alertness frequencies and meditative frequencies. My approach is biased toward keeping people attentive or making them more attentive, improving cognition. Starting middle C is a little flat.
I was diagnosed with generalized anxiety, ADD, and just general depression. I was just on a downhill track. My symptoms of my anxiety were just taking over my life and I couldn't function. And his Brain1st treatment just completely took my life in a 180-degree different direction. When I walked out of his office that day, I felt like a different person, like it happened that day. He looked at my brainwave activity and he told me that the medication that I had been taking, Vyvanse, was like pouring gasoline on a fire, and it was only making my condition that I had worse. Administering the right medication to me, it was just a night and day difference. And within 30 minutes, I felt the way that I had felt my entire childhood, and I could feel it instantly. I started doing really well in school. I started, hanging out with my friends again. I started just getting really involved in my life again.
In selecting medications, I find that if I'm improving a person's cognitive abilities, in general, their emotions will also improve. I'm not against pharmaceutical prescribing. Oftentimes, I can use one naturopathic agent or a modified vitamin, or I can treat a person with naturopathy.
I had trouble sleeping. I had a lot of anxiety and stuff that I was dealing with. Well, first he gave me an EEG and measured the voltage in my brain, told me where things were firing, where they weren't firing so well, and showed me in his way of explaining it to me how it would be improved if we were to take these amino acids. It's changed my life by giving me a deeper bridge to work from, meaning that everything that I've been able to do has been improving since then. My writing is sharper, my workouts are sharper, my people skills are better because I'm not so easily triggered. I'm a lot more able to sleep and get that good REM sleep and get the dream state. So every part of my life has improved with this brain treatment because it's made everything easier, made everything more accessible to me. He's a very, very interesting, wonderful man. I'm glad he's in my life.
Most people have no idea that their autonomic nervous systems aren't operating optimally and influence what they do and what they think every day. When you improve or normalize someone's automatic circuits that have been inhibiting them for X number of years, persons then can proceed through psychotherapy in a really constructive and more efficient way. Unless I'm measuring what I'm doing, I don't know what I'm doing to that person's brain.
I have, since my mid-20s, struggled with all kinds of health issues, mysterious health issues. My ability to write, to think clearly. I had been to literally dozens of doctors over the years, spent many, many thousands of dollars to try to get to the bottom of my problems. And nobody could really help me. Unlike all the other doctors, Dr. Emory's treatment for the first time in literally 20 years in my struggling with this made a huge difference. In fact, I was commissioned to write a biography. During the course of writing that book, I was being treated by Dr. Emory, and my ability to focus and to have the energy to do what I did, I can say quite truly that I would not have been able to do what I did without Dr. Emory. It's nothing less than life-changing. And so I'm really happy to say that whatever Dr. Emory is doing, I hope very much that others will learn this technique and will become interested in this technique, because he's clearly stumbled onto something huge.
I initially came to Dr. Emory because of my OCD and trichotillomania, which is hair pulling. Diagnosed with chronic alcoholism for 18 years, and I know that had to do a number on my brain also. And so until I met Dr. Emory, I hadn't slept in my 68 years of life without some kind of a sleep aid, except when I was a child. And so that were the four main reasons I came to him. And it's one of the best things I've ever done, ever, period, hands down. With the OCD, I was, in terms of one being bad, I was at the 1. And same with the trichotillomania and the sleep. All 3 of those were they were very bad in the 1-2 category. Today, my head hits the pillow and I'm sleeping within a minute or 2. And then when I do wake up in the morning, I didn't used to wake up until 8 or 9 o'clock every morning. Now I wake up at 5:45, 6:15. I'm as happy as any human being could ever be, having come through a process like this.
Doctors resist what I'm doing because of the study and practice involved in being able to read visual EEG. It seems to many of them overwhelmingly complex. I'm willing to teach anyone who comes and wants to learn. It's a little better than it was before, actually. It's a little less theta than you had before. Theta's not taught in medical schools, and that's the place where this kind of comprehensive approach needs to be nested in medical school and in physician residency programs. I think that we should do EEGs and quantitative EEGs on children before they enter first grade at age 6, so that we can identify those who are at risk with something that you can't identify from symptoms or behavior. I hope I live long enough to see the use of this across medical specialties, actually.
I think the reason why we don't go brain first as a reflex response, from sort of the pharmaceutical perspective, it's money. If it's not going to generate enough money, then what's the purpose of doing it, is sort of the thinking. You can see what's going on now. Everything's about making money. If the medication isn't making enough money, pharmaceutical companies stop making it. Whether or not people need it, that's just irrelevant.
I mean, he was actually taking a look at my brain and seeing what I needed. The doctors were just looking at a list of symptoms, side effects. For Dr. Emory, he's always told me, he said, you know, I don't really care what your symptoms are. He said, I just want to look at your brain, see what you need, give you the medication you need, and then if there are any issues, we'll talk. What you describe as your symptoms are not really relevant.
People know when they are becoming or moving toward brain-body balance, which is what homeostasis is. And it's a joy to do the work because they're improving, and I find it quite pleasant to experience that. That's why I won't stop until I'm incompetent, and I'm certainly hoping that in the next 3 years, I'll have 1 or 2 acolytes or younger people who will be able to learn this, and I can relax a little bit and knowing that it won't die with me.
I just found out today that he calls his process and his practice brain first, which I think is the greatest idea, because so many things do start there that then affect you physically in some way. So brain first, I love that idea. It certainly worked for me. As a matter of fact, I wanted to get another test today because I know that everything's peaking. I can feel it. Even though I seem like I'm not concentrating, I am at this age.
So, you know, you're like Yalom's acronym, young, attractive, verbal, intelligent, successful, except you and I are not young.
No.
We're OAVIS, old, attractive, verbal, intelligent, successful.